I'm certain we were all moved by what we saw. We were all moved before we, got here tonight to be part of something bigger, to be part of a solution. And one of the key words that I took from near the end of the film is the word consensus. What can we put together to work toward a solution? We've got five very important people to come up here to start talking about what we can do locally, and there will be an opportunity, hopefully we'll have time to get some questions and answers from you guys before we're done. But if we can get our panelists up here, I never like to be alone up here on stage. We'll start with Carol Alcorn, and you can all come up. You don't have to wait to be introduced. We'll get everybody up here and seated, and we'll give everybody a chance to get comfortable and get a microphone, and then we'll go down and meet everyone, find out what brings them here, what their area of expertise and involvement in this. And it's really like a puzzle piece. So pick a chair. Doesn't matter whether you're near or far. Of course, if you're on this end, you might have to start the whole thing. So.
See how Carol and I planned that out?
Yeah. See how that works. Our first panelist, John, introduce yourself.
I'm John Roque with Pathway Ministries. I've served there for about the last 8 years. We are a gospel-centered, a faith-based ministry of mercy that comes alongside folks that are experiencing homelessness, abuse, addiction, and we invite them on a pathway out of poverty through Jesus. That's our mission. We operate across 9 different facilities across Peoria. We have a staff of about 80. Really incredible team that serves that. We have internal services. We have 2 aspects of our ministry. We have residential services that would include emergency shelter, yet our primary focus is on lasting life change and program, a holistic, whole person approach, kind of that you saw somewhat modeled on some of the in the film. We operate on a budget. We are privately funded. We operate on a budget of a little less than $6 million annually, and we get to see in the last 3 years, for example, we've seen hundreds of men and women go through significant life change and have a new relationship with God. We've helped place more than 600 men and women in employment in the last 3 years and helped secure permanent housing for about 325 in the last 3 years. So that's a little bit about Pathway Ministries.
All right, great. Thank you very much for sharing. Next, tell us a little bit about yourself and what brings you here tonight.
Hello. Okay. Good evening, everyone. My name is Richard Rowe, and I work for the Department of Corrections, Illinois Department of Corrections. I'm a senior policy advisor with them. I'm also with the department, OPA, the Office to End and Prevent Homelessness. I report to the Director of IDOC, and I also report to the Chief Homelessness Officer, which is Christine Haley. Some of you may know who she is. I've been doing this for quite some time. Recently in this new role, June. But prior to that, I've worked with the Corporation for Supportive Housing, AKA CSH, doing a lot of TA, and I did the reentry work for the agency for about 7 years. That was the national work that Corporation for Supportive Housing did around reentry. Prior to that, with Heartland, some of you may know of Heartland Alliance, worked with them for about maybe 7 years as well. The other thing that I'm a part of is our local COC, the Continuum of Care. I'm the current co-chair of our COC in Chicago, and I've also chaired it twice, actually 3 times. So just a little bit of
Experience,
yes.
in other words.
Yeah. So.
All right.
My name,
Claudia.
Yep.
Yeah.
My name is Claudia Hernandez Schaefer. I am the Director of Asset Management for the Housing Authority for LaSalle County. I just took on that role in May. Previously, before that, I was a Section 8 coordinator, a caseworker. I had about 260 Section 8 tenants that I worked with. And before that, I was a Section 8 intake clerk, so I did all the verifications for the Section 8 applicants. So that's just a little bit about me.
All right, welcome. Carol.
Hello, John.
Hello.
I'm Carol Alcorn. I'm the Executive Director of Illinois Valley PADS for 20 years. We have 2 shelters, one in Ottawa and one in Peru. We have 55 beds in Ottawa, 74 beds in Peru. We provide homeless shelter, 3 meals a day, bed, care, case management. And we see a lot of people, your neighbors, your friends, your family come through the shelter. And we appreciate the courage everyone has to walk in that door and to ask for help. So we have, in the last year, served 562 last year, 492 the year before. 89 children. Children are hard. We're concentrating on families. We're really intentionally reaching out to the families. The ROE said that there was 310 homeless children in our region. So we want to reach out to the children and families and help them. We work with them to get through resources and get back to self-sufficiency, and we're very excited when that happens.
Okay, and finally, Vanessa.
Thanks, John. I'm Vanessa Hoffeditz, and I work for Tri-County Opportunities Council. We are a community action agency. Those exist statewide and nationwide. We were established in 1965 as a part of eliminating poverty in our country. So we are still working really diligently in that area. And some of our programming also includes housing assistance for individuals who are at risk of becoming homeless through rental assistance or for arrearages, mortgage payments for past due payments. We are also working to what we call rapidly rehouse those individuals who are literally homeless and on the streets. We work closely with the PAD shelter as one of our primary partners to try and move people out of the shelter and into affordable housing. In addition to that service, we provide other wraparound services to assist them with short-term certifications, transportation, child care, a litany of programs based on their needs to try and help stabilize, and as Carol was talking about, build self-sufficiency so a person can maintain their housing and lead the quality of life that they're looking to lead.
Okay, thank you very much. Can you guys hear okay back there? All right, fantastic. Good, glad to hear it. We have a series of questions. We really want to set this up as just kind of a panel discussion. So I'll probably start with one, and I think I'll start with you, Carol, on the first question. But at any point you have something to contribute, please jump in, and we'll just see how it goes. We do want to try to keep it moving and hopefully leave enough time for some Q&A at the very end with you guys, because you guys are maybe the most important piece to this puzzle here tonight. So, Carol, let's start with the first question, causes and possible solutions to homelessness.
We've tracked the causes for about 10 years, and the number one cause is loss of job and income. The second one is a family dispute. So those are the top 2 reasons that people in our region are homeless. It's lack of income and family disputes. Now, what is a family dispute? So boyfriend and girlfriend are living together, and one of them disagrees with one and they kick another one out, and where do they go? They end up at the homeless shelter. Or divorce, or families, parents and children, step-parents and children. Those kind of instances where, we are there to be a place where they can land and repair those relationships or find a new way forward in moving forward to housing of their own. What was the next part of the question? Solutions?
Yeah, solutions.
Solutions. So there are.
Just a little one there. We'll
Yeah,
start
there
with
are-
a tiny one.
There are a lot of issues. Solutions, there are gaps, and there's gaps in mental health care, there's gaps in substance abuse care. The community has come together to address those needs. There's still ways to go on that. There's also gaps in childcare for that single parent who needs childcare so she can go to work and be employed and have self-sufficiency. There's a gap in transportation. There's a gap in employment and those kind of things. So solutions are varied dependent on the situation, and we try to find all those solutions.
That's one of the things that I took away from the film is how individual it is, and how the solution really does need to be individual. Any other possible causes that we didn't talk about?
Well, I think one of the things the film touched on was affordable housing. So maintaining housing has gotten more difficult. So as rents have been increased and people are not able to afford those rents, we're seeing that people are coming to us, in our case, more at risk of facing evictions. And to Carol, talking about those things that are kind of gaps, affordable housing in our area, in all of our 9 counties that we serve, it's extremely difficult to find housing that even a 2-income household can afford, let alone a single-income household or a household, as Carol was mentioning, someone has an illness and they're no longer working and the other person is working. There's just no way to maintain that.
Okay. Let's step back for just a second to the kind of the 30,000-foot level, and one of you talk about the difference between chronic homelessness and situational homelessness. Richard, maybe?
Okay. So it depends on what you want to know about chronic homelessness or situational homelessness. So first of all, before I answer that, I'd like to go back to the other question.
Please do.
So there is another point that I just wanted to make about, it's the barriers, it's the structural racism, it's these things. There is so much there, so much, just to look at what are the causes of, that's what I'm getting at. And then when you break it down to the case by case, that's when you start getting into the solutions, there are folk who, like the one gentleman in the film, lost his ID, little things, that it snowballs into these other things. And we have these systems that are in place, but we have to acknowledge those systems and dismantle those systems, So, but I know I'm preaching to the choir, But with the chronic homelessness, that's one of the things that HUD, our federal government, we use that definition, with 4 episodes in a year, and this is the funding that all of our COCs, everybody's competing for these dollars with these strict definitions. And then a lot of the communities of faith don't partake in these funds for a number of different reasons, you know. But these are the things, if there's a willingness or if there is opportunities, you know, for these dollars, you know, the chronically homeless dollars. But we pretty much dance to this music. That's the way I like to call it, having been part of Chicago's continuum of care for so many years. It's those dollars, but we can't use them the way that we need to use them. There's no flexibility in that. But with the one-time or situational events of homelessness, we use other funds for these because we can solve these things. And that's where we rely on funds that are not government funds. So that's the way I like to separate it out. So hopefully that's helpful.
Yeah, absolutely.
John,
Yeah.
I know we're on limited time, but he used the term continuum of care. Would it be helpful to you guys to understand a little bit about what that means?
Absolutely, yeah.
Because I think that plays into what we're talking about when we're talking about this issue of homelessness. To your point, the state of Illinois is divided into different regions, and those are called continuums of care. Our organization belongs to one of the continuum of care. Within that, we then take those numbers that he was talking about related to people who are at risk of becoming homeless, those who are literally homeless, chronically homeless. We have data that we collect. Our organization in our area goes out in January, and we try to find individuals who are homeless. We're doing a point in time count, and then those numbers get turned into the state, and then the state will then determine the funding that comes into our area to assist us in meeting the needs of the people who are homeless in our area.
Correct. How many CLCs do we have, Brenda?
19.
19 throughout the whole state.
Good knowledge. Thank you very much. Vanessa, talking about collaboration just a little bit. Talk about how important it is and how we can foster organizations and community leaders, elected officials into addressing these issues.
For us, collaboration is a main mission of community action agencies. We can't do everything we do without working with partners, many of whom are in this room today and who are at the resource table. We don't run a pad shelter, but Carol and her folks run a pad shelter. So when we know that someone is homeless and they're on the street, because we have that relationship with them as an organization, we can get that person to them. They in turn can then send individuals to us who are ready to get into a housing situation so that we can then help to be able to hopefully pay for that rent and that deposit to get them off the street. And then with the help of the other organizations that some who are here today, whether that's Aruka, Perfectly Flawed, other YSB, other organizations that were here, we can then do those wraparound services that can help that person. You know, it's a holistic approach.
One of the wraparounds that we need to mention is that the demographic that's growing is the senior citizen. Children and senior citizens are the group that's growing the most. And so alternatives for older adults, we've used them, and a lot of different other networks that we can use with wraparound services.
Our local police are people that we need to be in collaboration with as well, because they're encountering individuals who are facing homelessness, and they're often the first step to getting those folks to the different organizations. It takes a lot of communication. And the public at large, all of you who are here today, probably are one of the most important collaborating factors we have, because we know what we live every day. Carol and I were talking after the film that we heard a lot of these stories. We hear those in person. For some of you today, it was the first time you heard those types of stories, right? And so if you can go out and be our partner in talking about the humanity of the people that we are talking about, that's one of the most important collaborative steps I think that you can take. Because when you see someone as a person first, then you're willing to start to be involved and take a step to take the action that needs to happen.
John, you have something?
I was just echoing, you actually took the words right out of my mouth, and it's wonderful because I think if we think of poverty and homelessness as a problem to solve, we all know we'll feel overwhelmed by it. And it feels like it's unsolvable. And that's, you mentioned at the end, we have to think about it as a person that we can come around and, because they all have names, they all have stories, and when we think about the causes, we serve about 160 men and women per night on average at Pathway Ministries in our residential ministry, and it feels like there's 160 reasons and causes of why those folks are there. It's almost impossible to think about it as a monolithic or as even as a group of causes. Are there underlying and are there some consistencies? Sure. But boy, it means getting down to it at a personal level. That's one of the reasons that book that was mentioned, I think, is a good book to get us started in understanding when we walk by, because it really talks about that, making it personal. So as we talk about how you can be involved, that's the first step, is making it personal to you, and then getting involved at that level.
You know, how many of you have seen those people at the corner in your town with those signs, homeless? Yeah, okay, we've all seen them. As I've traveled around the country, my husband is kind of going, oh no, a homeless person, she's gonna stop and talk to them. And I do, I stop and I visit with them, and I ask them, they're asking me for $10 to go to McDonald's to get a hamburger. Or some guy wanted to sell candy to me in Milwaukee. Chris is back there laughing. You know, you start to have a conversation with them. You know, how are you doing? Well, where'd you come from? Because I really think that they want you to be interested in them. And I think we ought to be interested in our friends and neighbors and find out what they're doing. And so the one lady said, I'm from New York. Well, what are you doing in Atlanta? Well, I just came down here. It's warmer. Well, where are you living? I'm living under the bridge. Well, how old are you? 67. What services do you need? I just came out of a shelter down the block. Can they help you? Can we walk down there, see if there's something we can do? I made her promise that she would go to Social Security and apply for her Social Security, and gave her the $10 to McDonald's. You know, just have a conversation with them. Who are they? You know, they're real people. They have a real story. Don't do it with judgment or looking down at them. You know, that goes for any age group. You know, it breaks my heart to see the newborns in the shelter, starting out in the shelter. Let's have a heart. Let's find out. One of the things our shelter does is, after 3 or 4 days, we do a questionnaire, and we get to the root problems of what barriers they're actually experiencing. And then we build a service plan based on their interview with them and their goals in each of those areas, and that's their map through our services. And I think that gets to, you need to get their story. You need to find out what things are they struggling with. And then have conversations and talk to them and find the resources. Today we have resources all over that we use, and they use our services, and so we have a network here. Are there gaps? Yes, there are. Yes, can we work on it? Yes, we can.
It's not just a homeless problem, it's a human problem. And as soon as you put the face on it, it changes everything. You talked about resources just a little bit. What are some of the critical resources needed to help that you may be getting or may not? Anybody address that a little bit?
I go back to affordable housing. I can't, I
And let's drag Claudia into
keep
this.
going back to that because we see that so often. So many times in communities, when people who are coming in to want to build affordable housing, that NIMBY thing happens, the not in my backyard.
I think we just saw that
Yeah.
in Ottawa just in the
Okay.
last couple of weeks, right?
So what I'm saying is that affects the community as a whole. It's not just people that are in the pad shelter that Carol is working with, or people I'm seeing sitting across from me who are telling me that they're 3 months behind on their rent and they're going to be evicted. There are many individuals in our community who are what we call precariously housed, which means I still have a roof over my head, but all it will take is one thing to happen in my life and I will become homeless. So our communities need to come together to try and figure out how we think about recruiting affordable housing in our communities. Because there isn't enough. And you can probably speak to that.
So for us at the Housing Authority, for public housing at least, we try to keep our deposits at $100. That is not the case in the private market. You know, a lot of times they're asking first and last month's rent plus a security deposit. There's no way that people can come up with that. You know, there's just, it's something that's so unbelievable that people are even asking for that. The other thing is, yeah, we have seen a huge raise in those rental markets, you know, for Section 8 alone. So for those of you that don't know, Section 8, we give the clients a voucher. It is up to them to find a private landlord that they would like to rent from that is willing to work with us in the Section 8 program. The applicant will pay approximately 30% of their adjusted annual income. We subsidize the rest. And we're just finding now, because of course we have no control over what HUD sets as our, you know, limits. So some of these landlords that are asking, you know, an outrageous amount for rent, we can't even help the clients with that rent because HUD will not allow us to. So it has become a big problem trying to find landlords that are willing to lower those rents so that we can help these people out. It's a huge problem. For public housing, like I said, we like to keep our deposits at $100 because we know people can't afford, you know, huge deposits. And for their first month's rent, we prorate that amount. So we don't expect them to pay for the full amount of rent, obviously. We do work Tri-County quite a bit. Servant's Heart, you know, we have a resource book that we can give clients, applicants, that has all the numbers for these different resources that they can contact to try to get help to pay for those deposits and those rents. And we tell them if they ever, you know, have problems paying their rent, they can reach out to these people as well. There's a lot of agencies that will help with that, so.
Okay. It's hope for tomorrow, and we're going to get to the hope part, promise. But really want to talk about what you see happening in the next 5 years, what you think needs to happen in the next 5 years to get ahead of this. You want to start, John? You're nodding your head.
Well, I would say, given our track record over the last, you saw some of those statistics. I think our reliance on institutions of government or education, again, to solve this problem is likely not going to solve the problem. And so I can tell you for us, again, at Pathway Ministries, we are faith-based. We are working to engage people in the church to care enough to be involved and get and drive community. Oh, sorry about that. I'm an old man now. I need pills, apparently. But, so we need people, because in the end, I'll just share again for us, our definition of poverty might be different than a lot of folks. We don't believe poverty is a lack of material things, just a lack of material things like money or homes or cars. We believe poverty is the brokenness that we all experience in the four fundamental relationships of life. Our relationship with God, our relationship with ourselves, our relationship with others, and our relationship with the rest of creation or work. And we all, number one, experience brokenness in those relationships at some level. So we're all poor. We all experience poverty. But if that's the definition, if it's a whole person, if that's the way it works, then we're going to have to bring whole person solutions to this. And that's going to have to be relational. It's going to have to be person to person. And that takes a community. Because when we talk about homelessness or the brokenness and addiction and all those kind of things, without community, we're all there. That community is such a huge aspect of that, and that doesn't happen at an institutional level. It can't. It happens first at a personal level.
All right, Richard, what do we do?
Yeah.
What?
So I'll just say, I have to, let me approach it from another angle. So, because I'm with the state. So looking at that just statewide, I think that just breaking down some of the silos, working in government, I really, really discovered that folk don't like to play nice in the sandlot, and you ask, why are you doing it this way? And you know that answer, because we've always, done it that way. So I think that we're in unique positions. That's my colleague over there, Brenda O'Connell. She's uniquely embedded in IDA, Illinois Housing Development Authority, right? And I'm in IDOC. The reason why I'm bringing that up is because this was the brainchild of, Chief Haley, putting us in there so we can make a difference, and didn't give us any restraints, so we're like, we can be bulls in the china shop if we, but we didn't go in, that way, at least I didn't. But at least I can interrogate these processes, and that's what we need, statewide, why is it that organizations, the smaller, lesser known mom and pop organizations aren't getting the opportunities, no, we want to bring them in. And so we're in there now.
Good.
And so these are some of the things. So within the next 5 years, I'm hopeful that these things will trickle down throughout the state.
Great.
So,
That's the
Richard, I'm just
collaboration.
going to jump in and say, we have, again, we're private, we're faith-based. However, we have an incredible relationship with IDOC. We began a new program in the last year called Reconnections that is specifically for men and women coming out of incarceration and through reentry, because they have specific needs, don't they? They have and so we're excited and we love our relationship right now with IDOC, and they've been recommending actually more than we can actually service, from a capacity standpoint. But again, we love that collaboration because we all have a role and a part to play in this. Affordable housing is an important role. Personal connection, building communities is an important role. Again, the coordination between government agencies, all this is really important to have a full house working on the same goals.
So I see 5 years. I'm hoping that we can address homelessness holistically by addressing the needs and meeting them. And that is a community thing. PADS can only do so much. Tri-County can do so much. Housing can do so much. The state can do so much. They can provide programs, and Peoria provides for us. In fact, we connect with Peoria often because their shelter provides services that we don't have here. So when we have someone who needs the services, we'll send them to Peoria. We'll refer a Rockville, a Bloomington. So I see the community coming together and we collaborate with one another in a new way so that we get the wraparound that we need and we see what the gaps are and we begin to fill them. For instance, in Ottawa, we have just started a minimal program in meeting outreach for those who have left the shelter and need help and kind of panic when they run into situations that they don't know what to do with. And so we're trying to outreach and Peru is also doing that too. They get a lot of phone calls and work with people who are in their homes already that have needs. And so we need to not look at homelessness as an issue or a problem, but as a human being that has a destination somewhere and needs help. And so, you know, do you enable them? Do you give them everything? Do you require accountability? Do you do those things? Of course you do. You need to. But you also have to give them the hand up, not just the handout. And so I look for a larger, either a larger campus idea or a idea where the agencies begin to work directly with each other, even at a deeper level than we've seen in the last 20 years that I've been here. But 5 years ago, I would hope we would take that state money, that community money, that lily pad store money, and we would use it effectively to reach the needs, the real needs, the relationship needs, the caring, compassion needs that we need for this community.
So we're seeing the collaboration. Can we get a consensus on that approach? That we think that perhaps gives us the best chance to get these people back on track?
One agency is not going to do it all.
Right.
That
So how do we do that? What's the missing? You talked about gaps. What needs to happen for us to get there?
I would like to address, we are addressing the mental health on a level that's better than we've had before. We're addressing the substance abuse also in a way that has not been done so well in the past. There's gaps. I would like to see childcare be addressed. It breaks my heart when a single mother comes in with several children and it's really hard to even get her to look for a job because there's no place to care for her children. That's a problem. And it's a problem not only for a homeless person, it's a problem for a college student, it's a problem for the newly married and small children and got to go back to work thing. It's an issue. There are gaps in prevention, there's gaps in aftercare, there's things in which, and some of them are larger than others. We have to discuss it.
I think the other thing for me is in 5 years and where I see the gaps is, and I was glad to see some of our elected officials here today because I think that's an important piece that we're missing as well. Members of their community, whether that's village trustees or whether that's mayors or whether that's city councils, whatever government entity it is, needs to be coming to the table to recognize that homelessness is something that they need to be a part of coming up with a solution to. So whether that is, back to my piece about the affordable housing, how do we work to get entities to come into our communities to build affordable housing? How do we attract that? How do we establish guidelines in our communities for people to live in safe housing. We have people who are living in housing that is unsafe. That's an issue that still leads to risk, okay? So how do those entities establish rules and governance to landlords to ensure that people are in safe housing so that then a wall doesn't collapse and they end up homeless? Or they have mold in their apartment that's so bad that they're experiencing health issues and now they become homeless because they have to give up that living situation. So I guess for me, I would like to see more of our government entities involved in our areas to be part of the solution as well.
Okay, yeah, great point. We have a great crowd here tonight. Obviously, everyone here is vested. What can, and I want to get to question and answer, and I know we've got a hard out at 9:30 as well. So what can individuals here tonight do to make a difference, to help, to get involved? What's that first step?
I don't know this area, but I'll say that, first of all, just think about why are you here now? You know, so build off of that. You know, if there's a local COC, your church, whatever that is, whatever it is, it's get involved. You know, I think that's the first step, whatever it is. Just remembering, and we all know this, you know, we have to continue to normalize and humanize the issue. You know, it's not the others, you know, or those people, or, you know, it's not that. And just be mindful of those conversations, you know, and call it out, you know, call it out, you know, be bold, be brave. I think that the last thing that I'll say is be creative, think outside of the box, and interrogate the system. You know, that's it. Just interrogate the system. So.
I think Nike said it. Just do it. Right? Step in somewhere. And I'd say, again, make it personal. Step into a place where you can be involved, and not only just, and I'll say this, systems are important, but systems are built off of people. And if you're not engaged at a people level, you're not going to feel it, and you're not going to be able to, and again, if you want to really see somebody impacted, get engaged with them at a personal level, get to know their name, their story, and be a part of their journey to sustainability, and that'll hook you in.
Yeah.
And I think to the point of being engaged, we need to ask the people that are experiencing homelessness, what do they need from us? That's got to be the starting point here. We can all sit up here, we can talk about what we think it should be and how it should be done. But if you know someone who's homeless in your life, reach out to them, have that conversation, ask them, what do you need from me? But what do you need from your community to help you out? Because, I mean, you can build a great thing, but if you haven't talked to the people who are experiencing it, they're not going to come.
We've had individuals in the community who've had their sons, their grandsons, their nephews in our shelter. And just think about what you would want to do if it was someone you loved, how you would want them to be treated. And don't rely on just the government and the tax dollars, which we get and are available, to solve the problem. They can't. They can't do it alone. It takes money to run programs, but it takes people to touch people. And so we need people to touch people. And if that is you talking, have you ever seen somebody on the corner with a sign and go and park your car and go talk to them? I have. It's very interesting. It's very interesting. We just found out the other day that a lady, very pregnant, could only speak Italian. She was out there with a sign. So we found somebody in the community to speak Italian. Go find out. Offer her husband a job. So she, you know, people, touching people. So if that's giving supplies to an agency, if that's supporting an agency with your finances, if that's supporting them with your volunteer hours, if that's just stopping and talking to someone in the corner. Finding out who they are, why they're there. How can I help? Are there resources? Do you know of resources? What's going on? So, you know, it's going to take the government, it's going to take the church, it's going to take the individual, it's going to take the person yourself reaching out to those that are needy.
Terrific. I'm going to turn it back to you guys. You have questions? Anybody? I've got a mic. I can come at least part way if you want to come down here. Where do we want to start? Start over here.
Take the microphone. I think that's my
Got another one. We can work on both sides of the stage, perhaps. I'll come down to the front if we can get somebody down on the other side, and we'll let you guys ask a couple of questions.
I was just going to walk them around.
And while we're getting this set, I will remind you that each of you had a form in the bag that you got when you came here tonight. Important that you fill that out. Big hand to these folks for the time they put in. Not just here tonight, but day in and day out. Of course, to Pat as well for all she's done, and everyone here at IBCC.
Yay, Pat Walters!
Yay, indeed. All right, who's got a question for the panel? Where? Luke, back in the... Oh, right there, okay.
Hello. Everybody hear me? My name is Jessica, and this is for anybody up here. One, I just want to point something out. I had worked for a recovery coach for a while for a place. And what I had noticed is Carol does so much for the area. People don't realize how much she actually does because everybody's not out on the street. We're not seeing them like we all seen in that video there. But what I can tell you is during my time as a recovery coach, there's so many people that she is responsible for keeping safe, right? So if something unsafe happens, or if somebody uses a substance or anything like that, they can't stay at that shelter, right? Because she is responsible for keeping all of those people safe. And one time, I remember we had a person who could not stay there. They were in a bad position. So they go downtown and they try and find a spot with a tent downtown. Well, they can't be downtown, right? They're not allowed to be seen. They have to be unseen. So now we have to push them out of town. So what happened was the foundation that I worked for was this man come up and he was very sad. He was upset because every single thing that he owned was in his tent outside of town. Barely outside of town, but outside of town, but he was still seen. He was still seen by the people in the city, and that was a problem. So what my leader did at that time was he decided to go to Walmart and take the money from his foundation, and he bought him a tent and got him things he needed, made sure he had food. So even though Carol takes care of a huge part of this problem, it's still out there and we don't see it because they don't allow it in town. Not everybody is going to have a heart to say, oh, somebody came here and they cut your tent open, they took your things, let me get you a tent, let me get you some food, because you're human, right? You're a person and you deserve to eat and feel safe and be warm when you eat.
That's a gap.
All of those things.
Yeah.
So what you do, people don't understand how far it really goes because we don't see it. But there's more than what we don't see out there. And all these foundations are taking care of these people. People with substance use struggles, okay? The people that are struggling with this and with the mental health. One barrier that I've seen, and I don't know that this stands true for anybody sitting on the stage today, was numbers. The state only has so much funding that we can give. So if your foundation has less numbers than your foundation, good luck on getting that money. We got to keep our money up. So we got to keep our numbers up, because otherwise we can't help. So how are we going to collaborate in a way that's not competitive? That is a barrier, in my opinion.
There are a lot of them. talking about substance. Luke, do you want to step in for just a second? I know you have something.
No, thanks, and I know we're short on time, but you know, I haven't used heroin since 2015, but I used it for over 14 years. And I know Carol knows my opinion on the video. I think one thing I want to call out of this video is they talked about harm reduction. I would say shame on the producer in the way in which they portrayed harm reduction, because what you saw on that screen was not an accurate portrayal of what harm reduction is. Harm reduction is caring about people, and harm reduction is that safety net that Jessica was talking about. It's that safety net where people might not qualify for services, or they might be too traumatized to even want to be a part of services. It's truly washing the feet of the least of these. And I was really sad to see the way that this producer portrayed that without giving an example or talking to someone that has, because I run a harm reduction program. What you didn't see in that video is an interview with someone that has walked through our doors that was greeted with love, that was greeted with, it was portrayed in, you know, that you're just giving out syringes and needles. No, what you're doing is you're telling the person, we value you. We're not here to judge you. We're here to support you. We're here to uplift you. We do not want you to die. So, harm reduction is a critical safety net. We also run a recovery support program as well, and I think it's really important to have this collaboration. So I really look forward to Tri-County and PADS and everybody coming together as a unit, because the harm reduction program is that safety net for the least of those in a community. And it's important to have these other agencies that we can hand off to, because my foundation, we're not a housing organization, we're not an inpatient treatment center. We're the ones that are out on the street giving sleeping bags for people who might not qualify for services. So if there's anything you take out of this video, I would never share this video because of the harm that interview of that certain piece does, because what that will do, that will increase fatalities, because harm reduction is love. And I think it's really important that we put more education around that in our community, because it's very obvious from this producer's perspective that more education needs to happen. So thank you.
Yeah, thank you, Luke. And I know that's a real hot button issue for a number of people. You had a question?
No, anybody that knows me knows that I really like to talk. I'm Brenda, I'm the program director in Peru. No, you're not gonna hold it, it's mine now. So I just wanted to add on to what the panelists, my hands were sweating, I really wanted to get up there. So I know you had asked for solutions, and although affordable housing is the main solution, it's not attainable right now. But what is attainable is that the community continue to stick together like it has been. And I just wanted to really give a shout out to the community, because anytime I post anything on Facebook that we're in need of milk, that we're in need of cereal, that we're in need of bread, it just pours in. I mean, every single day it just pours in, and without the community, we couldn't do what we do. Another thing is the agencies working together. We do work together, but I believe it needs to be unified in more of a collaboration. You know, we have this client, what are you working with that client? So we know we're kind of like we're handing the baton off, and we know where they are and what goals they have met already, and what they still need in order to succeed when they are out on their own. And then again, like I said, you know, taking care of, I have part of my staff here. I have my case manager, Jackie, and Sheila, my monitor. Also just supporting us in our own mental health, the hours that we work and what we put in. And then I know you talked about a personal level and knowing the job in a personal level. We know it at a personal level. We know all of our clients' names, date of births, their likes, their dislikes, how we can approach them, their personalities, their off days, their good days, and what exactly they need from us from day to day. And another way that the community can help, and maybe it hasn't even been out there, but just with watching this documentary again and listening to everybody talk, is we have teachers, we have bankers, we have mothers, we have fathers that can be amazing mentors in our shelter. You know, show us how to balance those checkbooks, come in and just be, you know, that life coach, that support, that father figure that a lot of our clients didn't have. And then very last thing, and I promise you can have this back, ask the clients what we can do for them. I did. They're here with me. And they said, give us the courage and give us the strength to be able to go out and do this on our own. We need that courage from you guys.
Great, all right.
Very well put. Very well put. Back here?
I've been living in this area for a long time. I've been renting over in Dalzell since March 18th of 2022, and I can tell you that rent was pretty good when I had the other landlord, and then he sold. I was paying $400 a month. I had 2 people buy the property. They changed the lease. Basically, they raised my rent from $400 to $475 per month. In 2023 of January, and then now I'm paying $525 a month, and my lease states a $50 increase in rent, and they're both working full-time jobs, married with kids, and it's a side income for them. And I am trying to see what, like, Vanessa Huffitz can answer this question, like, where do I stand as far as my rights, as far as, like, negotiating? Yes, you've had this property for over 2 years. But how about we keep it at $525 per month, or let me pay you, which will be at $575 in January, split it in 2, because with my paycheck, I'm getting $15.44 a month in a week per hour, and that's I think $1,600, $1,200 or so right now. It'll be $16 by next January. What I see right now is that our employers aren't keeping up with the rent plus inflation with food prices. That needs to change with how they figure cost of living raises. And I don't want to be in a situation where in a matter of months I'm going to be going through my savings. I've worked hard to try to rebuild. And yet I can't afford to buy a house. I'm not married. I have no children. So I'm supporting myself and trying to look at the rents in Peru and LaSalle is way too high. And then you look at going back to my parents, it's like that's not going to be the greatest thing emotionally, physically for me, because you know, it's changed. It's different when you're an adult and you're going back to parents that are retired. Not to put them on the bus, but it's just like, where do I stand when it comes to working with a landlord, 2 landlords that they're all about trying to keep up with what other places are renting, but Dalzell doesn't have a tax base that makes sense to me to be facilitating that much of an increase.
Yeah,
What we always suggest with folks when you're starting to get to that situation is having that conversation with your landlord. That's where it needs to start.
And I actually applied to the LaSalle County Housing Authority in spring. I'm on a waiting list. I just got a thing, I'm waiting for Bureau County Housing Authority to send one into me. I do agree that, you know, I would like to see, like, we have all these rules in this country and laws. I like to see these towns be really tough on trying to, like, start controlling these rents, because even though I'm not in this profession, I look at it, if you don't put all that money in and try to upgrade things, do you really need to be raising the rent? And don't be throwing the taxes at me and saying, oh, the taxes are going up, don't be trying to charge more rent. Well, I've been here long enough to know that Bureau County's taxes are high to begin with. So it's nothing new. It goes back to industry. You're telling me stuff I already know, but I just hope that they will work with me, because it's really frustrating.
Yeah, it has to be extremely frustrating, and I know we could continue talking down this line, but we are rapidly running out of time. You got something quick?
Yeah.
Real quick?
My name is Peter Hall, and I'm the son of Ivan Hall, who created IVCC in 1972. But I was homeless for one day with my 50-year-old autistic, severely son. June 8, 2022. I drove 600 miles to find a home for him, and he was highly anxiety. He stayed in the back seat playing this guitar. 1998, Johnny Cash played this guitar. I want to say this up to the panel. You people do a fantastic job. I hate to say it, but the system's broken. And
Here to try
yeah,
try to come up with answers for us. Sorry to cut you short, but we do need to be out here by 9:30, and we are there. Please, a hand for our panel. If you do want to revisit this video at all, it will be posted on Stark Rock Media's YouTube channel later tonight, perhaps. Mike Sabatini works on that. Get it up tomorrow, if not later tonight. Thank you very much for coming. Thank you again to the panel, Dr. Morris and everyone at IVCC. Make sure you fill out your forms. Be part of the solution.